skull base is the most complicated and the deepest area of the whole brain.
During our training process as a master student, we rarely get exposure to all these skull-based anatomies. The cadaveric workshop is really important because it's like you see the normal anatomy before you expose to the real patient abnormal tumors and anatomy.
To enhance our understanding of the skull-based pathologies, we were given exposure and guidance from the experts regarding how to tackle these skull-based neurosurgery.
When I use MyVeo, it's a stimulation of the field of the real surgeon. I can understand more of the depth and the clear margins of the anatomy compared with the parts.
MyVeo is help me between the surgery because sometimes the patient is in a difficult position.
It helps the neurosurgeon to maneuver in different angles and also provide the optimum view ergonomically.
I don't need to tilt my head, I just look straight. It's improved my posture, so after I go back, I don't need to massage.
Deep skull base area is hard to visualize with a small narrow opening like a lens. Can get the clear view in deepest operative field. So it helps a lot to design ergonomics, zooming speed, focusing speed. It is really brilliant.
Leica is my favorite microscope.
I really recommend the Leica for both of the professor, for the resident, or the trainee.
This type of educational cadaveric section workshop is essential to become a skillful neurosurgeon.